So today we are going to learn about remaining part of human anatomy, and this is also very important part. So we will see anatomical positions. Anatomical position, also known as standard anatomical position, is the consistent position of the human body in which positional references is made for anatomical nomenclature. It is not reliant on whether the patient is standing, supine, prone, sitting, etc. So these are anatomical positions. This is superior, upper part is superior, down part is inferior. Then distal means away from body, and proximal means near to the body. Medial, at the middle of the body. Lateral, anterior. Backside is also known as posterior. Okay. Then heads at the side of head means cranial, and at the downside means caudal. So now we'll see anatomical planes: sagittal plane, transverse plane, and coronal. Anatomical planes are imaginarily flat surfaces that divided the human body into specific sections, facilitating the study and description of anatomical structures. There are three planes of the body. First, coronal, also known as frontal plane. This is coronal plane. This is okay, also known as frontal plane. Separates the front means anterior and back means posterior of the body. Sagittal means longitudinal plane. Sagittal plane is also known as longitudinal, like this. Okay. Separates left and right side of the body. Left and right side of the body separated by sagittal plane, whereas front and back side of the body separated by coronal or frontal plane. And third plane is transverse or axial plane, which separates the upper or superior and lower or inferior halves of the body. Okay, upper and lower separated by transverse plane, whereas right left separated by sagittal plane, and back front separated by coronal. First we'll see coronal plane. It is often referred to as frontal plane. This divides the body into front means anterior and back means posterior sections. Anterior and posterior sections. Movement that occurs in coronal plane are lateral or side to side. This include abduction. Abduction means moving your limbs laterally away from the midline of the body. Okay? For example, lifting your leg to the side. Abduction means moving your limbs laterally away from midline of your body is called abduction. Whereas adduction means moving your limbs medially towards the midline of the body. For example, lowering your arms down to the side of the body. So abduction and adduction are the movements that occur in coronal plane. Okay, please remember these two terms. Abduction means moving limbs away from body, and adduction means moving limbs towards the body. Any doubt? Because this is also important. You will get straightforward question on this.
Yeah, no, I'm clear.
Next, sagittal plane, which divides our body into left and right. The sagittal plane, also known as longitudinal plane, divides the body into left and right halves. Movement that occurs in sagittal or longitudinal plane involves forward and backward movements. Our day-to-day activities usually occur in this plane, since we usually move by swinging our arms and legs in front of us. Okay, so sagittal plane divide our body into left and right. And third, transverse plane, also known as axial plane. Okay, it divides body into upper means superior, and lower means inferior halves. And movement that occurs in this plane involves rotation or horizontal movement. So these are three planes. This is some differentiation between different terms. Okay, anterior means situated before at the front of, whereas posterior means situated after at the back of. Medial means pertaining to middle near to middle of body, whereas lateral means far from center of body, part away from middle. Superficial means on the surface, not deep. And deep means away from surface, further into the body. Superior cranial cephalic means above or top of, and inferior means caudal podalic towards the feet. Proximal means towards the beginning, the nearer of two items, and distal means more distant, far from the origin. Inversion means to turn inwards, to turn upside down, to reverse in position or order, and eversion means to turn outward. Ipsilateral means on the same side, and contralateral means on the other side. Supine means with back or dorsal side downward, and prone means laying face downward. I got this question while in my CPC. Supine position. They give this term in this line and ask what is this position called. So like this straightforward question they will ask, and it is easy to score in this session. Okay. Then dorsal means relating to back or posterior, and ventral means relating to front and anterior. Next is body cavities. So cranial cavity and ventral cavity. Both cavity together makes dorsal body cavity. Okay, means back side of the body we have cranial cavity and ventral. Whereas in the front side we have thoracic cavity, abdominal cavity, and pelvic cavity. Thoracic cavity we have superior mediastinum, pleural cavity, pericardial cavity within the mediastinum. So the human body is divided into number of body cavities, which are fluid filled spaces in the body that hold and protect internal organs. The two largest human body cavities are the ventral cavity and dorsal cavity. Ventral cavity and dorsal cavity are two largest body cavities. These two body cavities are subdivided into smaller body cavities. Okay? So ventral body cavity is at the anterior or front of the trunk. Organs contained within this body cavity include lungs, heart, stomach, intestine, and reproductive organs. And it is subdivided into thoracic and abdominopelvic cavities. Whereas dorsal cavity, it is at the posterior or back of the body, including both head and back of the trunk, and it is subdivided into cranial and spinal cavity. So cranial cavity consists brain and pituitary gland, whereas ventral cavity consists spinal cord. Thoracic cavity consists lungs, thymus, heart. Heart also it is in mediastinal cavity. Okay. Abdominal cavity consists stomach, liver, pancreas, gallbladder, spleen, large and small intestine. And in the pelvic cavity, we have urinary system and reproductive system. These are quadrants of the abdomen. The abdomen is divided into 4 quadrants. Okay. First is right upper quadrant, then right lower quadrant, left upper quadrant, and left lower quadrant. You can see here. In the right upper quadrant, we have liver, gallbladder, duodenum, and some part of intestine. Okay, large and small intestine. Then in the right lower quadrant, we have cecum, appendix, and ileum. Then in the left upper quadrant, we have stomach, pancreas, left mixture, transverse colon, and jejunum. Okay, means some part of large and small intestine. In left lower quadrant, we have again some part of large and small intestine, sigmoid colon present in left lower quadrant, rectum, and anal canal. So why this is important? What do you think?
Why this is important? I don't have idea.
That is because it will be easy to identify exact cause of that symptom. Okay, mostly patient come with abdominal pain, right? The doctor will check and ask where you feel in pain. Okay, they press there and ask you where you feel the pain. If you feel pain in right lower quadrant, okay, that means it is possible that you have some issue with appendix or related to cecum, ileum. Okay, or
So,
inside
to
upper
diagnose the disease,
is what?
to diagnose the disease, it will be
Yes,
easy.
easily.
Yeah.
So if doctor knows that you have only right lower quadrant pain, he can focus on this area only. No need to go and search here, right?
I understand. Yeah.
If right upper quadrant is there, so mostly it will be related to liver or some gallbladder disease will be there. So like that. So we have means this medical system divided or abdomen into 4 quadrants. And we have separate codes. I already showed you that we have separate codes for each and every quadrant. Remember in ICD,
Yes.
in abdominal pain section, we have separate code for upper quadrant only for upper quadrant, only for right, lower or right side.
I remember. Yeah.
So that's why it is very important to read your document carefully. If you didn't get any specific diagnosis, you have to code your symptoms, that patient's symptoms. So you need to select proper code. Now, regions of the abdominal pelvic cavity. So these are region wise. Our abdomen is divided into 9 regions. Okay. First is right hypochondriac region, which consists liver, gallbladder, right kidney, and small intestine. The second region is epigastric region, which consists stomach, liver, pancreas, duodenum, spleen, adrenal gland. Third region is left hypochondria, spleen, colon, left kidney, and pancreas. Okay. Then right lumbar region, gallbladder, liver, and right colon is there. Umbilical region, we have umbilical or navel and parts of small intestine and large intestine. Then again we have sixth region is left lumbar region, which consists descending colon and left kidney. Seventh region is right iliac, which consists appendix and cecum. Okay, and eighth region is hypogastric region, which contains urinary bladder, sigmoid colon, female reproductive organ, and ninth is left ilia, descending colon, and ascending sigmoid. Okay. So in my examination, I got this question. I think how many regions are there in abdominopelvic cavity? Abdominopelvic cavity, they ask your answer will be 9, and
9.
so abdomen, if they ask, your answer will be 6. Okay.
But I don't understand. Can you repeat it?
This is pelvic region. If they ask you about abdominopelvic cavity, means how many regions are there in abdomen plus pelvis. Okay, your answer will be 9.
I got it.
Okay, and just abdomen you have 6. Clear?
Pelvic 3 region. Yeah, clear.
Okay. So read. It is very important to read your question carefully. Okay. They ask questions like that, also, like this also in related to CPC. CPTs. They'll give you all the procedure and everything, and ask you what code will you give, how to code you follow-up sections for same surgery. Okay.
Okay.
So like this, tricky questions will be there. So right now we'll see anatomy related questions. How many bones are present in adult human skeleton?
206.
Yes. Okay, just a minute. Next question. Which of the following structure keeps blood flowing unidirectionally in humans?
Walls.
Yes. Then which of the following type of cartilage is present at the joints of long bones in humans?
Long bones. Fibrous.
No, cartilage.
Calcified. Okay.
Calcified, no. It's a hyaline.
Hyaline. Okay.
Cartilage. Next, which of the following hormone helps in secretion of HCl from stomach?
Gastrin.
Yes. And last, which of the following innermost layer of human eye?
Innermost layer. Retina.
Yes. So this is how you will get a straightforward question on human anatomy. So right now you have time, as we have not yet started ICD.
Yeah.
So please go through human anatomy chapter and prepare for it. Okay.
Sure.
Human anatomy questions as early as possible. Okay. In the same folder. I'll inform you once I uploaded it. Okay.
Yeah.
These are the answers. Thank you for attention. This is end of this anatomy session.
Bye. Have a good weekend.
Yeah.